Welcome back to Journey to 600. Today we're going to be talking about cardiac examination. For our agenda today, we're going to be going through the blood flow of the heart, auscultation, blood pressure guidelines, and cardiac response to exercise. First, talking about the anatomy of the heart. So there's 4 chambers. There are the right atrium and left atrium. So the atriums are on the top, and you have the right ventricle and left ventricle, which are the bottom chambers of the heart. And the right and left correspond to the patient's right and left. Next, there are 2 types of valves, but overall 4 valves in the heart. So you have AV valves, which are atrioventricular valves. So they separate the atrium and the ventricle. So we do tri before you bi. So there's the tricuspid first and then bicuspid. So the tricuspid valve separates the right atrium from the right ventricle. And then you have the bicuspid valve, which separates the left atrium from the left ventricle. So those are atrioventricular valves. And then you also have semilunar valves, and they separate the ventricle from the big arteries. So the pulmonary valve separates the right ventricle and the pulmonary artery. And then the aortic valve separates the left ventricle from the aorta. So we'll get more into that next. So there are veins and arteries. So veins typically bring blood to the heart and it's deoxygenated. So all the blue on this picture are veins. So you have the superior vena cava and the inferior vena cava. They bring blood into the right atrium. And then the pulmonary vein brings blood back to the heart. Pulmonary vein is the only vein that is oxygenated. Then you also have arteries. So the pulmonary artery is the only artery that is deoxygenated. You have the aorta. So arteries take blood away from the heart. Veins take blood to the heart. And then veins are deoxygenated except for the pulmonary vein. Arteries are oxygenated except for the pulmonary artery. So getting back to the actual blood flow, blood comes in through the superior vena cava and the inferior vena cava into the right atrium. It goes from the right atrium through the tricuspid valve into the right ventricle. Then it leaves the heart through the pulmonary valve or pulmonic valve into the pulmonary artery. Then it goes to the lungs to pick up oxygen. The blood comes back to the heart through the pulmonary vein. Now it's oxygenated into the left atrium, through the bicuspid valve, into the left ventricle, out the aortic valve, into the aorta, and then to the body. Next up is auscultation. So there are 4 points for auscultation. It's based on what you need to hear. So the aortic and pulmonic points are where the semilunar valves are, and they make the dub sound of the heart, which is closure of the aortic and pulmonary valves. So that would be the S2 sound. The aortic valve is best heard at the second intercostal space on the right sternal border. The pulmonic valve is best heard on the second intercostal space on the left sternal border. So both at the aortic and pulmonic auscultation points, that is where S2 can be heard the best, the closure of the aortic and pulmonary valves. The tricuspid and mitral valves, when they close, that makes the lub sound, or also known as the S1 sound. So the tricuspid is best heard at the fourth intercostal space on the left sternal border. The mitral valve is best heard at the fifth intercostal space at the midclavicular line on the left. So S1 is a lub sound, which is closure of the AV valves, which is the onset of systole or contraction. S2 is the dub sound, which is closure of the semilunar valves, which is the onset of diastole. Abnormal sounds would be S3 and S4. So S3 is called a ventricular gallop, which is associated with heart failure, but can be common in athletes and pregnancy as well. S4 is called an atrial gallop, and it is associated with hypertension and heart attack. Here is the chart for the new blood pressure guidelines. So you really need to be careful about the and the or. So normal blood pressure would be less than 120 and less than 80. Elevated would be systolic blood pressure 120 to 129. Diastolic blood pressure still less than 80. So you have to have less than 80 diastolic blood pressure to be elevated. Stage 1 would be 130 to 139 or 80 to 89. So you can get either your systolic is too high or your diastolic, your stage 1. Stage 2, your systolic blood pressure has to be greater than 139 or greater than 89. So both need to be higher. After stage 2, there's really nothing else besides the hypertension crisis. So that's when it's like medical emergency. So systolic blood pressure is greater than 180 and or diastolic blood pressure is over 120. What is a normal cardiac response to exercise? Systolic blood pressure should increase as the workload increases, but diastolic blood pressure should remain constant throughout. Cardiac output is also going to increase linearly with increasing work rate as well as heart rate. Cardiac response to altitude. The initial response would be that blood pressure would increase as well as cardiac output and heart rate with no change in stroke volume. After you've been acclimatized, your blood pressure will normalize, your cardiac output will normalize, but your heart rate will increase and your stroke volume will decrease. What is the response to aquatic therapy? So you will have some cardiopulmonary effects. So your heart rate will decrease, blood pressure will decrease, edema will decrease, as well as vital capacity. But what will increase is your stroke volume, cardiac output, and work of breathing. For musculocutaneous effects, you will have decreased weight bearing. So depending on how deep you are in the water, it will affect how much percent weight bearing you are. Okay, now time for a practice scenario. So a 55-year-old patient presents to outpatient therapy for cardiac rehab post-CABG. He has a past medical history of hypertension and on metoprolol. The examination is as follows. So MMT 4 out of 5 for the quadriceps. 2-minute walk test is 100 meters. Vitals before exercise 76 beats per minute and blood pressure 132 over 86. Vitals after exercise 80 beats per minute and 140 over 86. According to the American Heart Association, how would you classify this patient's blood pressure? A, normal. B, elevated. C, stage 1. D, stage 2. I'll give you a moment to answer. If you're not ready to review, please pause. So this would be C, stage 1, because 132 is in the stage 1 systolic blood pressure, as well as 86 also matches the diastolic blood pressure. So stage 1 would have systolic blood pressure 130 to 139 or diastolic blood pressure 80 to 89. So for this case, they both fit in stage 1, but you have to know that it's an or, not an and. Next question is the onset of which of the following heart sounds would indicate heart failure exacerbation? A, S1, B, S2, C, S3, or D, S4? I'll give you a moment to answer. If you're not ready to review, please pause. So, knowing which heart sounds are normal versus abnormal. So S1 and S2 are normal heart sounds. So really, you should rule those out and be picking between S3 and S4. S3 is the best answer. So S3 indicates heart failure S4 indicates heart attack or hypertension. So the question asks which would indicate a heart failure exacerbation, so that would be S3. Thanks so much for watching. Don't forget to like this video, subscribe to our channel, and turn on notifications. See you next time on your journey to 600.